Good morning. Today in our studio we have Dr. Dayaprasad Kulkarni from Bangalore, India. He is a doctor by trade, working at the community level for the past 8 years with vulnerable population. Welcome, Dr. Kulkarni. Can you please tell us what brought you here to the US?
Namaskar and good morning. Thank you for having me here. I've come to the US this time to attend the 19th International AIDS Conference, which was being hosted in Washington, D.C. this year. And I'm a participant here along with 23,000 other participants from all the 183 countries. So this is one of the biggest AIDS conference in the world and happens every alternate year. And I'm here for that.
Oh. And can you give us some highlights of the conference, or rather you've attended various other conferences on HIV and AIDS, so how was this one different from the others that you've attended?
Yeah, I think every conference that I attend, there is a lot of, we hope there to see a lot of progress, and with hope we also see there is tremendous progress happening. Similarly this year as well, the tagline, the motto of the conference was turning the tide together. Okay. And we hope to turn the tide against HIV together in this conference. We are now reaching out to 8 million people worldwide who are on antiretroviral treatment. Even though there are 34 million people living with HIV across the globe, which is a big number, the prevalence in a lot of countries has been coming down. We are able to check the disease and people are able to live longer with HIV. So there is a lot of hope, and I'm sure we are doing good work across continents.
At such a young age, what got you involved with such a sensitive issue of HIV?
HIV was a big topic while I started medicine as well. It has been big for the last 30 years, and I was definitely intrigued by it. But the community I work with, especially the transgenders, the commercial sex workers, homosexuals, street children, children who are rescued from sex work, these are all really vulnerable populations, and they are the most at risk for HIV. And the stigma and discrimination which is attached to these communities also prevents them from getting access or treatment. So I realized when I used to see a lot of hijras in India who would come at street signals or in trains and ask for money.
Right.
Initially I was very scared with them, but at one point I decided I should stop and ask them why they're doing this, and what else could they do. And slowly I started talking to them, and I realized that they're a very marginalized, very isolated community, and they don't have access to a lot of things. Even though the government has a lot of programs for HIV and for counseling, for awareness, these people are always discriminated and stigmatized. So they don't even want to go access these services. And there is no exclusive service to these people. So that is one of the reasons why I started working on HIV, and I started working with communities, closely interacting with them, getting to know their personal issues better, and also trying to understand what their needs are.
Okay.
And that was, I think, primarily the reason why I've been in the field of HIV for this long.
You started your own NGO, a non-profit organization, in 2007.
Yes.
It's a great step to reach out towards the community. Can you tell us something more about it?
Yeah, I did start one NGO in 2007. What led to that was, I think, the tsunami of 2004, which was a big turning point in my life. I was finishing my MBBS, I was doing my internship and posted in community medicine when the tsunami happened on December 26th, 2004. Then I got together with a bunch of my friends. A lot of my medical friends did not want to come with me, but I was clear that I have to go there and do whatever I can. So I met with a couple of my photographer friends and students of fashion technology, and we raised about 2-3 lakhs. That's nearly $4,000 or $5,000 US. Wow. And we bought about medicines, vegetables, clothes, blankets, and then took a van and rushed off to Nagapattinam. There are 2 small hamlets called Akraipete and Kichangupam. I've worked with them for nearly a year after the tsunami. I learned a lot while I was there. So we were just 8 of us, set up a small tent, and we were providing medical facilities. We were one of the first camps, medical camps there. And as we were giving help, we had these non-medical people handing out drugs, dressing the wounds. Right. So I just gave them basics. And we lived in our van for about 8 days and survived on cup noodles. Oh. So it was a great experience, but then I realized there were a lot of big NGOs who were also there, and all they wanted to do was put up their banners and take pictures. They wanted me to come and join one of their banners,
Right.
so that they could show that they were doing this. And I think that is, and through the year I saw a lot of agenda driven or ulterior motive driven work happening in these areas. So I was very clear that if I have to do work the way I wanted and reach out to the community, I should set up something on my own.
Right.
And it took me a few years to actually understand the dynamics of the development sector, working with other NGOs, working with other international organizations as well, to find out how best I could set up an NGO and then work to benefit the community.
Okay. So you said you also learned from other NGOs, and in addition to your own organization, you were a part of other groups too. Can you tell us more about the other organizations that you were a part of that helped you create your own?
Yes, so after finishing my MBBS, I did a master's in clinical research from UK, but then I was already involved working with other non-profits like Jagruti, for example, which works with sex workers, children rescued from sex work as well, and we also have a home care center with about 200 children who are HIV positive in Bangalore. We take care of all their needs. So I learned a lot about working with the community. We had free clinics for the marginalized population, providing counseling, HIV testing, free STI treatment. And then I also worked with a couple of international NGOs. One of them was MSF, Médecins Sans Frontières, Doctors Without Borders. I'm sure all of you have heard of it. They do great work in conflict areas. So I worked in central India, in Chhattisgarh, which is completely affected by Naxals, by rebels. We set up a 10-bed maternal child health center and 5 mobile clinics in the remote, hard-to-access areas. And I learned a lot. There were a lot of foreign doctors and nurses and volunteers who were coming in to work in these remote parts, but there were very few Indian doctors who would volunteer, maybe because of lack of knowledge or lack of a platform. I think I learned a lot while working with MSF as well.
Oh, okay. And you've been providing free service for all these years. If you decided not to charge your patients, how do you survive and how do you sustain your living?
Yeah, that's a tricky question. I know money is not my priority, but money is necessary for a lot of things. I've always, a lot of my work I do is trying to drive away from focusing on money and make whatever my work is least fund intensive. But yes, you need money to survive. So I live with my parents still. I'm not married, so my basic requirements are very minimal. And there are also umbrella organizations like Seva International from the US, Youth for Seva, who pay an honorarium and take care of my basic needs. So yeah, I think that's covered. And once you're doing genuine work and you see there is a need for serving other people and you're doing your best, I think everything else falls in place.
Okay. So in addition to this wonderful work, what are the other activities that you're involved in currently in addition to what you've been doing to serve the community?
At this point, I would like to mention about 2 initiatives. One is Doctors for Seva and the other is Handloom. Doctors for Seva is an umbrella, comes under the umbrella organization called Youth for Seva, which works with youth primarily. But DFS, like I said, when I was working in MSF, I realized there is no platform for people within India to volunteer. So DFS, or Doctors for Seva, is trying to provide this platform for both medical and non-medical volunteers to provide service in the healthcare sector. Okay. So you could be a doctor, you could be a dentist, you could be a pharmacist, a physiotherapist, a non-medical person, but still you would have an opportunity to come and volunteer, provide your service in any health-related areas. And the other is Handloom. Handloom is again an initiative, marketing initiative. It's an online portal which markets various products made by NGOs and non-profits across the world. We have about 300 NGOs in India and another 200 from across Southeast Asia. And this provides a platform, a direct link between the buyer and the NGOs who make these products, so there is no middleman and they get all the profit which comes out of the product.
We know that you've made some short films on such important causes to educate the mass. Can you elaborate on those, please?
Okay. Last year, I've produced 2 short films, both 20 minutes each, one on child abuse and the other on homosexuality. And we're using these films to reach out to as many people and spread awareness in schools and with adolescent girls and college students. And this year, we are also we've made an animation video on menstrual hygiene, and we plan to reach out to nearly 30,000 girls in the rural communities and talk to them about menstrual hygiene, about sanitary napkins, use of sanitary napkins, and their sexuality questions, because they don't have people where they feel safe to talk about all this, and there are a lot of school dropouts and people just stop coming to school once they reach puberty and they have menstruation because they don't know what else to do. So this video, I hope, will reach out to as many girls. We're also trying to translate it into most of the Indian languages and then circulate it so that more people can benefit from it.
Dr. Kulkarni, is there anything else that you would like to share with our viewers, and rather, how do they get in touch with you in case they want to support your initiatives or volunteer?
Sure. Like I said, Doctors for Seva is a great initiative where people can come in and volunteer. We have about 10 interns from the US this year, about 5 from Switzerland, Denmark, Iceland, who are volunteering in India on various projects of ours. We also have Indian doctors who would like to come and work on some of the projects and share their skills. We had a doctor recently, Dr. Shah, coming in and providing a workshop on CPR and basic life support skills. So there are various opportunities, and if you would like to know more and volunteer and support our cause, you could look at our website, which is www.doctorsforseva.org, Seva with a V, S-E-V-A. Or you could even write to me at Dr. Daya at doctorsforseva.org. I would like to give a small message as well. A lot of people ask me, what is it that you're doing and how do you do it? I think their passion is something which is basic, which is very, very important. So once you have a passion to do something, but that's not enough. You need a professional approach. Right. You need to do things rightly, and then you also need the will to actually do it. There are a lot of people who discourage you, who say this is not going to happen, this is so difficult, why are you not doing regular things which other doctors are doing? But then once you have the will to do it and you're driven by passion, I think you can do anything, and everything is definitely possible.
We thank you very much for visiting us and sharing this valuable information with our viewers, and we wish you good luck for your future endeavors.
Thank you very much. Thank you.